Okay, wonderful. So thank you for joining us today for our medical laboratory science session, where you can learn more about the program and meet the program director. We are going to be getting started in just a moment, so we're going to give our other additional registrants just a couple minutes to get logged in here. So feel free to take this time to get settled in. And if you have any questions throughout the session, please feel free to type them into the chat feature or into the Q&A feature, and we will either address those throughout the presentation or we will get to those at the end of the presentation. So definitely make sure you're typing your questions into the chat or Q&A. Okay, and again, thank you so much for joining us today. We're going to be getting started in just a minute. Okay, and I think we're going to go ahead and get started. So welcome everyone. Thank you for joining us today. And my name is Elise Todderud. I'm a member of the admission team at USciences, and we're super excited to have you on the call today to learn more about the medical laboratory science program, which is personally one of my favorite programs at USciences. If you have any questions throughout the presentation, please feel free to type those into the chat feature or into the Q&A, and we will answer those throughout the presentation or hold them until the end if it's more program and major specific. So at this point, I'm going to turn the session over to Diane Valentin.
Great. Thank you so much, Elise. I appreciate that. And thanks to the admissions team for holding this event. This is wonderful. So I just want to say welcome and good afternoon to all of our attendees. And to start off this program, I'm just going to introduce myself and the one other MLS faculty member that is part of the program. So again, my name is Diane Valentin, and I am the program director of the MLS program at USciences. So I am in my 5th year as an instructor at USciences, and I'm also an alumnus. So I am an ASCP certified medical technologist, and I've worked in the field of MLS full-time in the microbiology lab and molecular diagnostics lab for 17 years. And I've worked in community hospitals, state laboratory, and the VA medical healthcare system. Margie Reinhardt, who is also ASCP certified as a medical technologist, has successfully ran the program as the program director of the MLS program at USciences for more than 30 years. In fact, when I was a student at USciences, back then it was called Philadelphia College of Pharmacy and Science, Margie was my advisor. So we're kind of like a little family here at the MLS program at USciences. So for she and I, our careers have come full circle, and we are both committed to provide students with an excellent education and preparation for their clinical rotations and eventual employment as an MLS. So before I start delving into the actual program, I just want to show you this short 2-minute video about what an MLS will be doing in the clinical laboratory on a daily basis. And please, Elise, let me know if you can't hear the sound. I'll try to figure that out.
So Dan, I think we don't have any sound right now. Let's see if we can.
If we don't have sound, then I'll just skip it. And the attendees will be able to, maybe I can record this and then embed it into a later demonstration down the line that will be available online. However, you can look this up yourselves if you'd like to do that. So instead of me trying to figure out how to work the sound here, I thought I had it correctly performed, and I apologize for that. So this just shows you what the people do on a daily basis in the medical laboratory departments. Okay. So the MLS program at USciences, and I feel like yes, okay, I apologize for that. This is going to be a 3+1 hospital-based program. So what that means is the student is going to spend 3 years on campus doing their didactic work, and then 1 year during a clinical rotation, performing their clinical rotations at an NAACLS approved clinical program, which is going to be at a hospital. So that's why this is considered a hospital-based program. So the MLS program curriculum does have a major clinical focus. The clinical requirements or the MLS requirements courses will be basic concepts of medical laboratory science. You'll have a couple of MT specific courses that are 1 credit courses, orientation and seminar, MLS electives, which are below here, hematology, human parasitology and clinical microbiology. Another course, human molecular and cell biology, genetics and immunology. So you can see already how science and clinical related this field is. Some of our MLS electives that other majors do participate in would be hematology, human parasitology, and clinical microbiology. Now, if you are on the fence as to whether you would like to major in BMS and MLS, or just for your own information, what isn't required in the MLS program would be a 2nd year of math and a physics sequence. So we do not require that as part of your your curriculum requirements. Because you only spend 3 years on campus, a minor may not be something you would be able to do. The only way that you could minor is if you have enough credits coming into the university to be able to free up that space for a minor. So where would you be performing your clinical rotations? We are affiliated with all of these facilities. They're all hospitals or medical centers, and only 2 of them are located in Philadelphia. Now that's not by design. That is just the truth that there are only 2 MLS programs in Philadelphia that we are able to affiliate with because there are only 2. The others are going to be either close to Philadelphia or way outside of Philadelphia, such as in New York, Ohio, and in Ohio and Cleveland. There is tuition that needs to be paid to these hospital programs. However, Pennsylvania Hospital does offer a tuition reimbursement program after 2 years of employment. St. Christopher's Hospitals for Children is considering tuition reimbursement, but that is just something that's in the pipeline for them that hasn't been solidified yet. The really great thing about this program is that most graduates are employed before graduation. So you are hired before you graduate. And then after that, 100% of our graduates are employed after graduation. This is significant. There's a large demand for MLS because a lot of the MLS are starting their retirement process. There is an increasing geriatric population that need extra health care, so they're going to require extra testing. And there's more complex instrumentation that's being developed and implemented within the laboratories. At these facilities, there may also be a sign-on bonus. So that means when you sign on for employment, you get extra money. Now, you're not going to get that extra money up front and say, here's $2,000 cash. They're going to incrementally put that into your paycheck, but it's extra money. What is also not listed here is a lot of these facilities have tuition reimbursement. They may reimburse tuition for further education. So that is also a bonus if you would like to move on to do some extra education or go on to a graduate degree. So graduation from a USciences MLS program with successful completion of clinical rotation will allow you to place the designation MLS with parentheses ASCP with superscript CM after your name. So that is going to be your professional designation that you are going to be awarded after you pass your ASCP exam. So again, our graduates have enjoyed 100% employment after graduation. And during your clinical rotations, many students are employed part-time, and then they move on to full-time employment after graduation. And so why would you want to be an MLS, right? So there's guaranteed employment. There really is. That is not an exaggeration at all. You're going to be at the forefront of medicine. And the pandemic has proven the necessity of the MLS professionals within the laboratory. And there's going to be new methodologies and instrumentation that are going to be utilized and developed. And so we need new, fresh folks that are coming into the department to be able to quickly learn this new instrumentation. And so that is the next bullet down. MLS are in demand. Many will retire within the next 5 to 10 years. So that is going to prove that there is vacancy that is to be had, not only presently, but it's going to be compounded within the next 5 to 10 years. Again, if you would like to collaborate with physicians and nurses, but not actually be in front of the patient, this would be a really great career for you. There is opportunity for advancement as an MLS. Further education will allow for related careers, such as infection prevention and control, working as an instructor like myself, working as a supervisor, and there's many multiple other opportunities out there as well. One important new degree out there that is related to MLS, and you actually have to have an MLS degree to move on, is called the Doctorate of Clinical Laboratory Science degree. And that's going to allow you to be an integrated part of the medical patient care team. So you will be involved in patient care. You will be involved with consultation for lab tests and diagnosis. And that's going to this is designed to save money, save time, and lower medical costs. So I'm just trying to educate you on the different aspects of MLS and what you can be doing down the line with this degree. So here are some more not educational, but employment opportunities that can be had with this degree. The majority of MLS do spend their time in the clinical laboratory. And so the majority of these laboratory departments will be what's listed here: microbiology, hematology, serology, blood bank, and chemistry. And so the clinical laboratory is especially important for the maintenance of health and the diagnosis of disease. And so doing that, we're going to be assisting the physician with patient care. You can also work in a place like the Red Cross. So this is going to ensure that donated blood is infectious disease free if the infectious disease is actually detectable. We are going to be determining ABO-RH blood typing of donor blood. And then we're going to be separating donor blood into its component parts. So if you need plasma versus coagulation components, all of that will be performed at the Red Cross. Infection prevention and control, I had mentioned that before. The importance of this job is to track and record infectious diseases in healthcare systems. And we all know that COVID-19 is an infectious disease. So these people will be tracking these patients throughout the hospital, not only the patients, but the personnel as well. And part of the job of infection prevention and control person is to train healthcare workers in infection control and containment protocols. So I was just in discussions with one of our alumnus who he himself is an infection prevention and control director, and he described his job as training adults on how to wash their hands. And so if you wash your hands, you're going to be preventing a lot of these infectious diseases from being transmitted from person to person. But it's definitely more than just that simple act of washing your hands. There's a lot more that goes into it. We do have an alumnus that also has worked in the National Institutes of Health, And she has worked in the exotic disease research lab, such as Ebola. And she's also gone over to Africa and helped set up and train people in the Ebola detection laboratories over there in West Africa. This degree may require a graduate degree, or not, this type of job may require a graduate degree. Um, However, it's still a very rewarding career after that. And then you can also go into something called sales and support. So you're trying to sell a laboratory product. You're supporting the people that are doing the testing in the laboratory. You're trying to troubleshoot any kind of issues that might come up with the instrumentation during laboratory testing. And so you don't have to work in the laboratory if you're an MLS. You can go off into any of these other types of fields and more. There's many other aspects of MLS than just working in a laboratory. So why MLS at USciences? I'm sure you have heard by now that we are a science-minded institution. So the more you're immersed in science, the more you're going to come out of the MLS degree thinking like a scientist and not just like a person performing science. We have a rigorous curriculum, which is going to allow you and I guess allow you is the best way to put it, allow you to become a lifelong learner. It's going to teach you how to learn. And this is what we do at USciences. Not only is our curriculum rigorous, but the faculty are caring, or the advisors are caring as well. So we challenge you, but we want you to do well. So we're here for you and we support you through your pathway through USciences. And I feel that the MLS program at USciences is excellent preparation for your clinical rotations. Just through formal and informal surveys through both students and program directors of these clinical rotations, they have stated time and time again that USciences students do perform better than comparatively to their peers coming from other institutions. So it's a great program. It's to allow you to be the best MLS person that you can be. And we also like to say that we have, and it's proven that we have 100% pass rate of ASCP certification MLS exam. So that's really important as well. And so I just want to show you a little bit about how we try to have fun at USciences and how we try to have fun as MLS students. So this was in 2019. This was within the basic concepts of med lab science class. I had given students extra credit if they could dress up during Halloween that had an MLS theme. So their costume had to have an MLS theme. And so this is T Long. He dressed up as the worst USciences or MLS student, or the horror MLS student. And so how he's dressing, he has open-toed shoes, he has ripped jeans, and his lab coat isn't buttoned. So this is just something very simple that they could have done. This person, is like HIV, and he's coming to attack you. This person here, so this is Lily, this is Eric. Lily dressed up as a blue top vacutainer tube. So that's one of the tubes that we're going to draw blood in. And this is Sarah, and she says that she's an expert phlebotomist. And of course, she can't be an expert. She's got holes all over herself and she's got blood splattered everywhere. So this was a really fun way to kind of bring in MLS in a way, and then also to earn some extra credit. This is a picture of our Medical Laboratory Science Student Society. And the members this year in 2018, they had decided to put on a murder mystery night, and they had to solve a mystery using the laboratory tests that we employ in the classes that we run for MLS laboratories. And so all of these students here are MLS majors. Some of them have graduated. So this is Daphne and this is Delgi, and they've graduated, and the other three here are still continuing students at the university. And this is just a picture of what we're doing presently. So this is 2020, learning during the pandemic. And we have 4 students here, and they're all socially distanced, and we're all wearing our masks. And yet we can still learn during the pandemic and do it very, very safely. Um, I'm in my almost 12th week now of teaching this course. And, we've been doing it great. We've been doing it very, very well. And students have been enjoying themselves while they're learning during the pandemic. And so as part of an MLS person, we're very much in tuned with the different causes that we can be involved in. So since this is November, it's also Movember. So just full disclosure, USciences does not endorse this. It was just something that I wanted to put in here just to say, all of you guys, remember to go get your health checkups, because since November is also termed Movember, you're going to grow a mustache to promote men's health. So I just want to throw that little thing in there. If we have just a little bit more time, I just want to quote something that I had just read in the ASCLS Today publication from she's termed an ascending professional, so somebody who's very new at MLS, who's working in the MLS lab. And this is something that she has said she wanted to communicate with everybody about her experience of working during a pandemic, and as well as performing COVID-19 testing. So she says, working with SARS-CoV-2 testing, I've had opportunities for my career that I probably would not have had. So then she goes on to say, quickly, I was working more than 60 hours a week and loving the opportunity to be right in the middle of it all. Most coworkers thought I was crazy for working so many hours, and supervisors worried of burnout, but I was truly excited tracking this mystery zebra. I was able to track COVID-19 through multiple departments, as I am a generalist on the 11 p.m. to 7 a shift. I work chemistry, hematology, coagulation, urine analysis, and blood bank. I was now able to see patients' positive tests and how the course of this virus would affect so many different areas of the laboratory. Blood bank was one of the first to feel the effects of COVID-19. The decrease in donations and subsequently in our inventory was alarming and stressful for our hospitals, as we are a level 1 trauma center. Then we began the use of convalescent plasma at our facility, further impacting the blood bank. Also, practitioners started to notice coagulation issues in COVID-19 patients, causing 262% increase from the month of March to April in the number of D-dimer tests ordered. This forced our facility to place unexpected emergency orders for coagulation reagents. So as you can see, the direct impact of COVID-19 has had on people like myself that do work and currently work in the as an MLS in the clinical laboratories. So with that, I'm going to end my little presentation, and I guess we have about 6 minutes if anybody has any questions for me. And thank you for your attention.
Thank you so much, Diane. And just a reminder, if anyone has any questions, please feel free to type those into the chat feature or through the Q&A, and we will be happy to answer those for you. And also, I just want to reiterate another key point about the MLS program is that if you are considering University of the Sciences and you are considering the Medical Laboratory Science program, you are actually only paying the USciences tuition fee and your kind of direct cost to USciences for the first 3 years in the program. And just to clarify, for that 4th year, you are not paying tuition fee to the university. You would be working directly with the hospital or clinical location that you're working with. So it's kind of another benefit of this program versus some of the other bachelor's degree programs. Okay, so we got a question that says, is there a strong alumni network?
So you would be, that's a good question for Casey Ryan, who is in the alumni, he's the director of alumni relations. He is, I have to say, and I have stayed in contact with the latest graduating class. So usually people start to drop off. So I myself may not be in in fluid contact with alumni. I do contact them on a regular basis, try to at least, but Casey Ryan would be the person to really dig and sink his teeth into trying to get these alumni to be more engaged within the university after graduation. So I would have to say, I don't know, defer that question to Casey Ryan over at Alumni Relations, because like I said, they kind of drop off after the first year. So that's the honest answer for that question.
And yeah, Diane, I guess I'll kind of also say as well that from my experiences working with students from the admission side and just hearing from our faculty members across all different variety of programs, the faculty members get to know their students extremely well. So they get to know the students well enough that, you know, if they have a connection somewhere else, or if the student needs a letter of recommendation, they're able to do that, and they're able to write a personal letter and really provide a lot of personal attention for our students who are looking for jobs, who are looking for employment, and who are also looking for that, maybe going on to graduate school. So we have a really strong campus community here. And I know that Diane had mentioned that earlier, but that's something that we really pride ourselves in here at USciences with our faculty members and the size of our institution. So that's really one of our big selling points here. Okay, so we got another question here. So the question was about the average accepted GPA to the medical laboratory science program. So as an institution overall, for our last incoming class, the average accepted GPA was right around a 3.7. For students who are considering attending University of the Sciences, the minimum required GPA that we look for a first year applicant would be a 3.0. So just keep in mind the average is 50% of the students have both above and below that GPA. So that 3.7 is the average, but the minimum that we look for students in terms of applying to USciences as a first year student would be a 3.0 GPA. Okay, so again, if there are any questions, please feel free to type those into the Q&A or the chat section, and we will be able to answer those for you.
I think I know what the problem was with the video, and I know we have 2 minutes, but I don't know if it would be advantageous to go ahead and show that since we have 2 minutes left.
Sure.
It's up to you, Elise.
Sure,
Okay.
yeah, if you want to show that, that would be fine. Yep.
Yeah, why don't we do that? Let me go back. I didn't click a button, so hopefully, Elise, you can tell me if you can hear it now.
I am a medical laboratory scientist. I analyze patient specimens to provide vital information the physician uses to diagnose and treat a disease. In fact, over 70% of medical decisions are based on the information my colleagues and I provide to the treatment team.
I am the healthcare professional who alerted the physician of your critically low potassium level before you went into cardiac arrest.
I am the healthcare professional who confirmed that your child had cystic fibrosis, knowing that I would be testing sputum specimens from your child for many years to come.
I am the healthcare professional that identified the genetic mutation that caused your lymph node cancer. Now your doctor can treat you with a drug that will destroy these cancer cells.
I am the healthcare professional who prepared 23 units of blood and blood products that kept you alive after you were involved in a moving vehicle accident.
I am the healthcare professional that told your physician you had a sexually transmitted parasite rather than a typical urinary tract infection.
I am the healthcare professional who monitors your blood glucose to determine if you need to change your diabetes medication.
I am the healthcare professional that identified leukemia cells in your blood when you came to the ER for fatigue and nosebleeds.
I am the healthcare professional who monitors your warfarin to make sure you don't have a blood clot in your leg or lungs.
I am the healthcare professional who identified the species of bacteria that caused your pneumonia and told the physician which antibiotic would be the most effective in treating it.
Gram-negative rod.
We are medical laboratory scientists. We count what's on the inside and get results.
All right, that was it. I'm sorry for the flub before.
Thanks, Diane. That was great. And for all of our attendees, I just put some information into the chat. If you have any questions for the admissions team regarding if you've submitted your application already, or if you just like to check in about your application status, please feel free to email us at our admission office email address. And if you have any questions, I'm sure that Diane would also be happy to answer those for you as well. So you could also reach out to her as well. And Diane, do you want to put your email address in the chat for everyone?
Yes,
Okay.
I absolutely can.
Perfect. Thank you. Yeah, so if anyone has any additional questions, please let us know. And okay, great. So I'm just gonna put that in. So if you would like to contact Dan, you can, and Dan, I'm just gonna copy that so that everyone can see. There we go. Perfect. Okay. If there are any last questions, please let us know. Otherwise, thank you so much for joining us today.
Yes, thank you, everybody. Appreciate it.
Absolutely. Thank you for joining us. Thanks for your messages. Okay, so looks like everyone